Good morning, Senators Murray, Begich, Blumenthal, Durbin, Rockefeller, Sanders, and other chairs on the Committee for Veterans Affairs. Thank you for your time this morning. My name is Jacob Sigler of the IAVA, the Iraq and Afghanistan Veterans of America. It is the first organization to help support the veterans of the new wars. In our ranks, we have over 200,000 members and supporters, and it's growing nationwide every day. There is an estimated 2.4 million veterans of the Iraq and Afghanistan wars, and we offer assistance for each and every one of them. We work towards our vision of a non-left-behind veteran through community outreach and assistance. War is hard, and the mental toll that it takes is our top priority. Our concern is a lack of mental health care for our veterans. On the active duty side, in 2010 alone, 295 servicemen and women killed themselves. In 2011, that number rose to 311. As each branch of service tracks their suicide deaths a different way, those numbers are actually a lot higher. The Veterans Affairs Office does not track veteran suicide. Nearly half of the returning veterans do not even see the Veterans Affairs Office for assistance. As we did a poll for our numbers, 40% of our IAVA members know a fellow soldier who has committed suicide. Recently, the Veterans Affairs Office announced that they're going to create a tracking system with the CDC that will log all suicides and log them for veterans, but it will take 2 years to complete. And in that time, more veterans will die needlessly. Suicides are not related just to mental health issues. Many veterans returning have trouble readjusting, cannot relate to their families, or have problems finding jobs, the reintegration. It's an endless list. But in order to combat the act of suicide, we must provide as much resources for them as we possibly can. This will cushion their return. The Army Surgeon General recommended that there should be at least one behavioral health specialist deployed overseas for every 700 soldiers. The VA has given a mental health diagnosis for more than 385,000 Iraq and Afghanistan veterans, which is more than 50% of the new VA patients. There needs to be more professional caretakers to help the growing number of veterans and mental health needs. We need to pass legislation that makes mental health a concern and priority for all service members and veterans. We need to address the issues, create and update training for superiors to identify signs and symptoms to prevent suicide. You need to pass S3340, the Mental Health Access Act of 2012, which will develop and implement a program over the prevention of suicide among members of the armed forces. It will ensure the continued medical education to provide physicians and the military medical treatment systems, and include education and training on the triage and referral of individuals with mental health conditions, standardize, assess, monitor DoD evaluation boards, physical evaluation boards, and physical evaluation board liaison officers. This will submit an assessment of whether the military departments are fully compliant and required of the use of the VA scheduling for rating disabilities and making member disability determinations. Committee members, it's a very serious issue with all of our veterans. And the fact that they are committing suicide is because they feel that they have nowhere to turn. And that is our failure as a nation. They deserve better from us. We need to give them everything we can. Thank you.